How to know if somebody have a problem with controlling their appetite? During a weight loss program, if you want to try very hard to reduce the energy that you eat, then you have to understand that there is a system that prevents you doing so. And that system is appetite. Regulating appetite during a weight loss program is essential because calorie deficit is essential for weight loss. Then the next question is how to make sure that your calorie is reduced. And in order to have the good compliance in calorie deficit program, or when you ask somebody to reduce calorie and they actually do it, we have to spot on and understand or be able to assess if they have a problem with appetite. So how to understand that, how to check that if somebody's have a problem with appetite, there are a few things that you can ask, and those components can help you understand how their ability to control their urge to eat. First, the frequency of eating episodes. How many times that you eat in a day? That is the first question. Do you think that you eat 3 times a day? Some people will argue, or some people will acknowledge that they eating just in their eating time, meaning that they have breakfast, lunch, and dinner, and that's it. But if you goes very deeper to understand what they eat and ask nicely, some people will tell you that yes, they have an additional meals or additional food that they eat within that eating period. So frequency of eating episodes. How many times that you eat in a day? 3 times, 4 times, 5 times? And we can actually look at the normal eating time, but for some people their eating behavior is not normal, maybe. For instance, somebody can have breakfast at 7 and they're already hungry at 10, and then they eat something at 10. And because just snacking is not very helpful, they goes into snack that's kind of big. Like they have a bit of fries at 10. And then at 2 or at 1, they're going to have lunch, but that lunch is not very small. And then they goes at 3 eating again, at 6 eating again. So they are hungry all the time. That is the sign that somebody have a problem with appetite. They have higher frequency of eating. Understanding this is important because when they are asked to do a low calorie diet or calorie deficit, they have to reduce all that frequency from 6 times a day into 3 times a day. Perhaps they might not reducing the frequency if they cannot reduce that, but they still need to reduce the amount of food that they eat. That goes for the second assessment, the size of meal when they eat. We can use plates and ask how much food that they put on this plate. Is that much? If we ask a certain foods like burger, for instance, or pizza, how many slices of pizza that they can finish, also with the size, how big the size of meal each time. If they're eating rice, we can ask how many rice spoon that they use to eat those. And those variations can help us better understand their ability to control what they eat. Because the concept of weight loss is to reduce those sizes. So not just frequency, but also the sizes. And next question is about energy density. We can ask whether this person, when they eat, what kind of food that they select. Is that energy dense food? Or they have less energy dense food? So if what they choose is higher energy dense food, then perhaps that would be a problem. Because if you're starving, or you keep starving, you keep want to eat, of course you want to satisfy the urge to eat by selecting food that is high in energy density. And how do you know that food has higher or lower energy density? By knowing the calorie of each food. What the typical food that somebody's eat? Is that high calorie? Do they eat fries all the time, or burger, or something with more fats or sugar in it, or not? And this comes down to selection of also for a low calorie deficit. So low calorie density foods, how much fruits that they eat in a day? Or they, if they have the choices, will they select the lower density options? Or they cannot handle that. When they eat an apple, for instance, they still craving for more energy density foods. That is how you can analyze if somebody's have a problem with the appetite. The other thing that might help you understand if somebody have a problem with the appetite is the variety of food that they can accept. What does that mean? Sometimes when we are doing a diet, we have to eat more vegetable, not sometimes, but actually all the time. We need to eat more vegetables, we need to eat more seeds and maybe nuts and fruits. But if somebody have the problem with appetite, perhaps they are very selective in a way of food that they eat. Most likely they are going to select the food that are more palatable, more nice, and usually also have higher energy density. And their variability of eating in day to day, we can also see that. Do they have part of the day that they eat more than the other day? And if that happens, how are we going to deal with that? So those combinations are to understand if somebody have a problem with appetite. And if they do, then the next thing we can do is address them and slowly deal with it. For some people, appetite can be controlled. There are ways to control appetite, and we're going to talk about that in the different video. But for this, I just want to mention that the assessment of individuals with problem in controlling appetite is essential, and we can have a look by asking question about their dietary behavior and indicate if somebody's have a problem with appetite. And if they do, there are several ways to deal with that, from diet or lifestyle changes into medication. But we're not going to talk about medication in the context. There are some food that can help you maintain or actually control your own appetite. We're going to talk about that in a different video. Thank you for watching the video until the end. If you are still interested to understand more about energy, appetite regulation in the context of weight loss program, please click the link at description. We have classes at Udemy for free just for you. See you.